Hello, I'm Dr. Suresh Chandra, practicing laparoscopic and general surgeon, currently working at Citizens Hospital, Serlingampalli, Hyderabad. Today, we will discuss a little about gallstones. People often get confused between gallbladder stones and kidney stones. So, to differentiate what are actually gallstones, we should know what is a gallbladder. The gallbladder is a pear-shaped organ which lies on the right side of the upper abdomen, underneath the liver, and its main function is to store bile. What is bile? Bile is a juice which is secreted by the liver to help digestion of fats. So gallbladder stores bile temporarily, and when you eat a fatty food, the bile is pumped from the gallbladder into the first part of the small intestine. So what are gallstones? So as simple as these are the stones which are formed within the gallbladder, and they can be of varying sizes. They can be as small as a sand grain to they can be up to a few centimeters or even a few inches in size, even up to a size of a tennis ball. So how do these stones form within the gallbladder? That's a common question which a lot of people ask. See, the main constituents of the bile are cholesterol, bile pigments and bile acids. These are the ones which help in digestion of the fat which we take every day in our meal. So if the cholesterol levels are more in the bile, you get cholesterol stones. If the bile pigments are more in the bile, then you get pigment stones. Sometimes you can even get mixed stones. So now we understand why we develop the stones and what are the types of stones which get formed in the gallbladder. So what do these stones do to us? Most often these stones do not cause any symptoms. Nearly in about 70 to 80% of the people, they just lie there and do not produce any symptoms. These are known as asymptomatic gallbladder stones. But what are symptomatic gallstones do, and what are the symptoms which we develop? The common symptoms which we develop because of the gallstones are dyspepsia, pain in the right upper abdomen. The pain abdomen can be in the right upper abdomen. The pain can be in the center of the abdomen. The pain can even be on the back of the right side of the chest. So at different places the pain can manifest. It is not the exact location of the pain which is more important, but the pain comes when you have a fatty meal or a heavy food. So the onset of the pain after a fatty meal in the upper abdomen is probably because of gallstones. So apart from this symptom, most often patients also do have some yellowish discoloration of the eyes or mild jaundice or high colored urine, or they may have nausea, they may have vomitings, and they may even have symptoms of acidity. Most often gallstone symptoms are confused with acidity, and patients do take some pantoprazole or omeprazole and feel that they are relieved. How does this pain get relieved on its own? What happens is when a stone is stuck at the point of the gallbladder entering into the bile ducts, it is only for a few minutes during the contraction. But when the bile starts flowing back into the gallbladder, the pain is relieved. So it is not because of the medicines you take, but it is automatically sometimes the pain is relieved. So who are the people who are at risk for developing these gallbladder stones? A lot of people ask us. All people who are obese, all people who are fair-skinned people, all people who are in their, especially women, and who are in their 40s and 50s, and apart from these women, mostly after pregnancy and during pregnancy, they have increased lithogenicity of the bile, and because of the various hormonal changes within the women during the pregnancy, they develop gallbladder sludge, and then sometimes that can even convert into stones. So apart from these things, if a gallbladder which is not functioning well can also give rise to gallbladder stones. Patients with liver diseases or patients with diabetes, or sometimes in some locations of the country, you have a higher incidence of gallbladder stones. Gallbladder stones can also run in families. Gallbladder stones can also occur because of in some women who take oral contraceptive pills. So what are the complications if most of the stones do not produce any symptoms or complications? What are the complications which the stones can produce in a patient with gallstones? That again depends on the location of the stone. If the stone is stuck at the junction of the gallbladder with the cystic duct entering into the common bile duct, then you may get a complication where the gallbladder can get distended, infected. It's known as acute cholecystitis, and it can become over distended, it can lose its blood supply, and it can become gangrenous, and it can sometimes even perforate. If the stone comes into the bile duct, then it can produce severe jaundice. It can produce all the symptoms of obstructive jaundice like fever with chills, vomitings, nausea, loss of appetite, and severe weakness apart from the pain. If the stone comes down further and blocks at the level of the duct entering into the small intestine, there another duct from the pancreas joins the bile duct. So the pancreas is also likely to be blocked and produce severe pancreatitis. Pancreatitis is one condition which is life-threatening and can produce such severe pain which will not be relieved with any sort of medicine. So these are the complications which can ensure in patients with gallbladder stones, and for the same reason the gallbladder stones have to be removed along with the gallbladder. Can we prevent gallbladder stones from occurring in us? Yes, we can to some extent prevent gallbladder stones in occurring with us, inside us. People have a tendency to do a lot of fasting and skipping meals. So if you skip your meals and do a lot of fasting, there is a tendency of gallbladder concentrating, bile getting concentrated and stones getting formed inside. And if you suddenly lose weight, you are an obese person and you want to lose weight, and if you suddenly lose weight, then also you can develop a lot of stones. If you eat good food with a lot of fiber, maybe probably your incidence of stones can definitely come down. So how to diagnose these gallbladder stones? When you have the symptoms which I have told you, the best and the only investigation which can reveal the gallbladder stones is an ultrasound examination of the abdomen, which will very clearly reveal nearly in about 95% of the stones, the gallbladder stones can be diagnosed by ultrasound scan of the abdomen. Yes, there are other tests depending on where the stone lies. If the stone is in the bile duct, another investigation which is known as MRCP can also help you in diagnosing the location of the stones, in diagnosing the condition of the gallbladder, and the other pathologies which exist along with the problems in the liver. There is another investigation which is invasive, where you do an endoscopy and do what is known as the ERCP when you have stones in the bile duct. And in ERCP, what they do is to cannulate the bile duct, remove the stones which are in the bile duct, and inject a dye and visualize the biliary tract. That is known as ERCP. So these are basically the investigations which are done for diagnosing gallbladder stones. CT scan is not a very good investigation, and most often stones can be missed in a CT scan, and it is probably not necessary to do CT scan for gallbladder stones. So once we have diagnosed the gallbladder stones by ultrasound, there are some patients in whom gallbladder stones are diagnosed just by ultrasound when they go for routine investigations during a master health checkup or some other checkup. So these are known as asymptomatic gallbladder stones. So you have not gone with pain, you have only gone for a routine ultrasound and stones have been detected. Most often, in majority of the patients, we don't advise surgery in these patients. But for asymptomatic gallbladder stones also, if the number of stones are multiple, more than 20, and if they are very, very small, or if the stone is a very large stone, or you are having a diabetes, or you are a person who cannot afford to when you are traveling, if you get a pain and you cannot afford to reach a hospital, like pilots or people who are in the Navy, so these sort of a people, even if the stones are not producing any symptoms, they can be removed. And those patients with certain blood disorders like hemolytic anemias and some patients who stay quite far away from the good hospitals, reasonably good hospitals where laparoscopic cholecystectomy is done, they also can undergo cholecystectomy or laparoscopic removal of gallbladder even if they are not symptomatic. Another group of patients are in some geographic locations where these gallbladder stones can produce even cancer. So in that belt of area where the incidence of gallbladder stones producing cancer is very high, again laparoscopic cholecystectomy is advised. So is surgery the only way out for the gallbladder stones? There are medical line of treatment, but the medicines do not work in majority of the patients. The medical treatment is quite prolonged, up to 2 years, and even after 2 years of treatment, once you discontinue the treatment, again you might develop gallbladder stones. And since I told you various life-threatening complications can occur with gallbladder stones, the best way nowadays is to remove the gallbladder with the stones through a laparoscopic method. So what is laparoscopic cholecystectomy? Laparoscopic cholecystectomy is removal of the gallbladder by putting 4 small 0.5 centimeter to 1 centimeter holes and removing the gallbladder through these holes is known as the laparoscopic method. This is a painless method. This is a bloodless technique where within a day you can go back home without any complications. If there are complications and if your laparoscopic cholecystectomy is very difficult, then probably in some patients there is a tendency to do an open surgery for removal of the gallbladder. This open surgery requires a huge cut, and this open surgery requires the patient to stay in the hospital for longer time, has a greater blood loss and produces more pain and side effects and complications of a major surgery. So if you have gallbladder stones and if you find a center where they do a gallbladder removal laparoscopically without much side effects, it is always advisable to remove the gallbladder stones rather than wait till the complications ensure and take a risk on your life. So this is all about gallbladder stones in a nutshell, and thank you very much for listening to me.